Some say the World Health Organization is working on a pandemic treaty that would give it control over governments. Is that really what's going on, though? Welcome to America Uncovered. I'm Chris Chappell. This episode is sponsored by Incognito. You probably know that companies are collecting your personal data, but you may not realize just how many. Dozens, maybe hundreds, most of which you've never heard of, and you have no idea what they're doing with it. Incognito helps you stop them. I'll explain more at the end. So, congratulations, folks. The world has finally stopped being afraid of COVID, and we're on to being afraid of monkeypox.
The CDC issuing a new warning now about monkeypox.
There are now about 250 confirmed or suspected cases of monkeypox in 18 different countries where the disease is not normally found.
We need to go back to our basic public health measures, identifying cases, isolating them, and managing them so that it doesn't spread.
Coronavirus, bird flu, free space, monkeypox? Hey, if the next one is bubonic plague, I win pandemic bingo! Come on, bubonic! Hey, help me out by playing around with some flea-bitten rats, everyone. But now that we've survived one global pandemic, are we more prepared for the next one? Nope. All countries remain dangerously unprepared for meeting future epidemic and pandemic threats. Which surprises me. I thought we were getting pretty good at this whole pandemic thing. The World Health Organization disagrees. It says our response to the next health crisis needs to be more unified.
There will be other pandemics and other major health emergencies. No single government or multilateral agency can address this threat alone. Together, we must be better prepared to predict, prevent, detect, assess, and effectively respond to pandemics in a highly coordinated fashion.
It's like Caesar said in Planet of the Apes, apes together, strong. Although gathering together is also how a lot of these viruses spread, so there's that. But yes, we must be better prepared for the next pandemic. So, what is the WHO's solution?
The world has come together before to dispel the temptations of isolationism and nationalism.
Yes, nationalism is the real virus. That's why the WHO is standing up to Chinese nationalism by letting Taiwan join. Just kidding. They caved to China as usual. The WHO's stance on China is like, fool me once, shame on you. Fool me twice, it's because it's hard for me to see when I'm so deep in your pocket. Right now, the World Health Assembly is meeting in person for the first time since COVID. That's the governing body of the WHO. This week, the WHO is looking at the international health regulations, and I know that sounds technical, but stay with me here. These regulations lay out how the 194 WHO member countries should respond to a global health crisis. They are legally binding, but they're also unenforceable. I'll explain why later in the episode. Now, the Biden administration proposed amendments to these regulations back in January. Politico reported that those amendments would give the WHO greater powers to act during a crisis. And people are freaking out. Some called it a sinister, secretive plan to cede power to the WHO.
The WHO would have decision-making authority to intervene into the United States government policy in any nation of the world without our permission. So, for instance, the lockdowns where you see 26 million people today locked down in Shanghai, China, they can't leave their apartments or homes. The WHO would have the authority to be able to impose that here in the United States for whatever pretext they want. They don't have to show data. They could do this.
So is the WHO looking for more power? WHO Director General Tedros has said, we need a stronger and sustainably financed WHO at the center of the global health security architecture. So he's not looking for more power. He's looking for more money and more power. And people are afraid that Biden will give him exactly what he wants, and maybe more. It makes sense people are afraid Biden would be a pushover. After all, he's not exactly known for his balance. But is the U.S. seriously about to give control to the WHO? I'll have more on that after the break. Welcome back. So people are freaking out about the WHO gaining more power over the US, especially after the WHO started talking about a new pandemic treaty. The pandemic treaty was proposed last year in an op-ed signed by the head of the WHO and 25 world leaders, mostly from Africa, Asia, and Europe. President Biden did not sign it. The leaders call for equitable access to medicines and vaccines for future pandemics, and more international cooperation with things like alert systems, data sharing, and research. It does go a bit beyond just pandemic response, though, like talking about a One Health approach that connects the health of humans, animals, and our planet. But so far, this WHO pandemic treaty is just an idea. We won't know what's actually in it until a draft is finished, and that draft won't be finished until at least 2024, if it happens at all. So how does this relate to the international health regulations? According to the WHO, the existing international health regulations are supposed to underpin the new pandemic treaty. The international health regulations have been around for over 50 years. They were last revised in 2005 after the SARS epidemic, which also came from China. These regulations define countries' rights and obligations in handling public health events. Now, both the proposed pandemic treaty and the current international health regulations deal with a global pandemic response, which is possibly why people get them confused.
The Biden administration is very close to handing the World Health Organization power over every aspect, the intimate aspects of your life.
Oh no, what will I do if some organization has access to every intimate aspect of my life? You know, besides the hundreds of companies that already have access to every intimate aspect of my life. I'm on to you, Alexa. I mentioned earlier the White House wanted reforms made to the international health regulations, and it's pretty clear that Biden's reforms are targeted at one country, China. There's been a lot of criticism that the WHO took too long to declare a public health emergency over COVID and was too deferential to China. Which, yeah, it was. So these new White House amendments are trying to fix that issue. For example, one amendment sets a stricter timeline for countries to report health emergencies to the WHO, instead of stalling for weeks while insisting that nothing bad is happening, like China did. It also adds the requirement, where possible, that countries share genetic sequence data, unlike sitting on genetic data for weeks like China did. The White House also wants to remove a clause requiring the WHO to consult with states before declaring a health emergency. And the White House wants to make it easier for the WHO to sound the alarm on a health emergency without state cooperation. Now, I see why people might be nervous about this, but again, it's pretty clearly targeted at China. After all, the Chinese Communist Party's weeks-long cover-up made the COVID pandemic much worse. And since then, the Chinese regime has blocked the WHO from inspecting its facilities and refused to share data with it. But Biden's proposal also increases the WHO's powers in other ways. The Director General can issue an immediate public health alert, even if it's not an international public health emergency. Essentially, it's for when you don't want people to panic, but you also don't want them to not panic. The WHO Director General has a lot of decision-making powers under these regulations. Although this isn't exactly new, it is one of the criticisms Biden is getting over his amendments. Biden also wants to create compliance committees to keep states in line. As far as we can tell, though, they don't actually have any teeth, which is an important point about these regulations. Like I said earlier, when countries agree to them, it's technically legally binding, but it's also unenforceable. The WHO doesn't have its own military or police force and can't even sanction countries. So countries like China can just ignore the WHO when they want to. So will these amendments actually change anything? More after this final break. Welcome back. The Biden administration wants to add amendments to the WHO's international health regulations. They hope it will stop countries like China from starting the next pandemic. But several Republicans in Congress have asked the White House to withdraw its amendments. They say they increase the power of the WHO at the expense of sovereign nations like our own. And many on the right say these amendments are a globalist scheme to surrender our sovereignty and healthcare freedom. But is it a real threat? Despite the press they're getting right now, these amendments are not actually on the agenda for this week's WHO meeting. Sadly, neither is not trusting China if it starts the next pandemic. Although that shouldn't be on their agenda, it should be carved into their walls. What is on the agenda is an attempt to speed up reforms from 24 months to 12 months. So changes to the international health regulations will go from moving at a glacial pace to a slightly less glacial pace. Frankly, I think the Biden administration is going about this wrong. Even if they change the rules, that doesn't mean China is going to follow the rules. The Chinese Communist Party doesn't follow international rules if they don't want to. Like when they rejected an international tribunal's ruling on the South China Sea because it didn't go their way. Here's the problem. The WHO isn't just a health organization, it's a political organization. The Chinese regime knows this, and after the SARS epidemic in 2004, it started grabbing more and more political power in the WHO. I talked about this on my other channel, China Uncensored. I'll put a link to the episode below. You see, the Chinese regime didn't like how the WHO treated it during the SARS outbreak, like demanding to see hospitals where SARS patients were being hidden. As the Wall Street Journal said at the time, the WHO's tough-on-China approach likely limited the death toll of SARS. But China's growing political influence over the WHO made it both less effective and more obedient to China over the years. Like when the WHO sent a memo saying they must refer to Taiwan as the Taiwan province of China. That explains why the WHO has been towing the Communist Party's line throughout the pandemic. So the Biden administration is using new rules to try and make China comply with the WHO, but rules can't solve a political influence problem. What the US should be doing is getting rid of China's corrupt influence in the WHO. And if that doesn't work, Biden could always pull a Trump and withdraw from the WHO. And this episode has been sponsored by Incognito. Whenever you do anything online, there's a huge number of companies that collect your personal data. Your name, your email, your home address, your social security number, your employment history, all sorts of things. So what are they doing with your data? Well, they're buying it, selling it, and trading it like you're a commodity. Worse, the companies that are holding onto your personal information could get hacked. Like in 2017, the travel website Orbitz was breached. Hackers got information on 800,000 users, including billing addresses, phone numbers, and emails. And if Orbitz can be hacked, so can all the smaller companies that buy and sell your data. That's why I signed up for Incognito. And I discovered there were 76 data brokers that potentially had my private information. I had never heard of most of these companies, but they definitely had heard of me. Incognito forces these companies to delete your data. There are laws that allow you to do this, but if you want to do it yourself, you have to figure out the applicable laws, write letters in a specific legal way, and follow up to make sure your instructions are followed. Incognito handles this for you. 3 months after signing up, Incognito had already gotten my details removed from 19 of these data brokers, with 35 more in progress. And I didn't have to do anything after signing up. So check out Incognito using the link below or go to incognito.com/uncovered. The first 100 people to use the code UNCOVERED will get 20% off. Get your personal data off the market with Incognito. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.